Hello and welcome to today's session. This is the second session based on the stages or phases of social casework. I want to give you a recap. In my previous session, I discussed on two stages of social casework, that is intake and study. Intake is the first step of social casework practice. That stage follows four basic steps, that is referral, personal data collection, family background, and early family history. Study phase is an important phase to diagnose actual issue of your client. In that stage, as a social caseworker, you will follow direct face-to-face interview with the client, and at the same time, you may follow indirect interview with the family members and collateral contacts to know more about your client. You can also do home visits to know the actual family status, followed by collecting information from the collateral contacts, which may be friends, neighbors, other relatives, school or college teachers, employers, employees, or anyone who is directly or indirectly associated with client. Now coming to the third stage, which is diagnosis. In casework, diagnosis or social diagnosis or assessment means critical scrutinizing of client, his situation and his problem, which help is sought or needed. Assessment or diagnosis aimed at finding answers of three major questions. That is, what is the problem? How has it arisen? And what can be done to solve it? The main purpose of social diagnosis is to work out treatment programs. In social casework practice, the worker used to follow two basic models which are discussed in below. Thought models of diagnosis are those of any effort to identify and explain the nature of a given problem, apprise it within a framework, that is or given problem, or to apprise it within a framework of particular interest of intentions, and to use that appraisals as predictive guide to action. In the course of diagnosis, the worker should be a talented and more experienced in A. The problem brought for solution. B. The functioning and program of the place to which it is brought. C. The goal and outcome. This model helps to identify what factors are to be subject to scrutinize and analysis in order to plan appropriate treatment. Next is problem solving model, which focuses attention on what the person wants and how much he wants it, that is motivation, in relation to the problem to be worked out, upon what capacities the person had or has not or can develop or can't, by which to cope with the problem to be worked, upon what means there are or are not in the aids and services the caseworker has on top, by which the problem to be worked or can be affected. Simultaneously, it seeks to discern why, for what reason, the person's motivation and capacity opportunity is inadequate to enable him to cope. Data related to diagnosis can be collected by interview, observation, tests, etc. Diagnosis should contain following information: A. Nature of the problem and client's relationship. B. Nature of person who bears problem, and C. Nature and purpose of agency and kind of help it can make available. Types of diagnosis. There are three types, that is clinical diagnosis means the person is described by the nature of the illness, that is schizophrenia, psychophia, typhoid, etc. Next, used in medical practice. Next, used in minimum in casework practice. And last one, importance in medical and psychiatry. Next, that is etiological diagnosis. In this process, the worker tries to find out the cause and development of the present difficulty. Caseworker also searches about the history of the client. The last one is dynamic diagnosis. Proper evaluation of the client's current problem as he is experiencing it now. Role of psychological, biological, social, and environmental factors in the causation of the problem. No attempt to dig life history. Caseworker and client engage in appropriate corrective action or treatment. Next, these developments may lead to modifications in the goals of treatment. For treatment, diagnosis. The step the steps used in diagnosis process. Caseworker begin to focus on problematic behavior and client's environment are studied. Complex behaviors are breakdown into clear components. Data are collected by various methods. Information and data are summarized to find out any major problems for treatment. Selected data are used for treatment in the final step of diagnosis. So diagnosis is basically to identify the core problem. So how you can diagnose? Prior to diagnosis, you did a study, and from that study, you collected information from various areas, that is from the client, from the family, from the collateral groups, and when you accumulate everything, you will get the actual source of the problem, and that problem is considered as diagnosis. The next, that is number four stage, is treatment. As per Hamilton, treatment is the sum total of all activities and service directed towards helping an individual with a problem. The focus is relieving of the immediate problem and, if feasible, modifies any basic difficulties which precipitate it. The objectives of social casework treatment are to prevent social breakdown, to conserve client strength, to restore social functioning, to provide happy experiences to the client, to create opportunities for growth and development, to compensate psychological damage, to increase capacity for self-direction, to increase his or her social contribution. Treatment principles are, according to crisis intervention model, relief of symptoms, restoration to the optimal level of functioning, understanding the relevant precipitating events, identification of remediable measures, recognize the current stress and their origins in the part like experience and conflict, initiate new methods of perceiving and thinking. Treatment techniques are supportive techniques, that is indirect treatment or environmental manipulation. Treatment directed towards bringing changes in the human environment, that is changes in family members, children's, their parents, children's school atmosphere. It is a strategy to bring out a change in a client's social functioning. Environmental manipulation attempts to correct or improve the situation in order to reduce strain and pressure and all modification of the living experience to offer opportunities for growth or change. Environmental manipulation, sometimes recorded as indirect treatment. After listening to and observing the clients, we may use our understanding of his personality structure, his pattern, his needs and conflicts, and his differences in order to manipulate those configurations. Reflective technique. Here the worker assists the client to choose and to use the social resources afforded by the community. Counseling technique, which is considered as a direct treatment. According to Sociolog Dictionary, counseling means a group of intervention procedures used in social casework in which the worker seeks to implement specific changes or improvement through personal contact with the client. The term was first used by Mary Richmond to designate a social worker's face-to-face interactions with individual or clients. Counseling is a process of helping the individual to know himself and the world. This technique basically follows the concept derived from psychology, which involves perception, learning, and motivation. These techniques also generate help in terms of prevention, curative, and remedial. Counseling is helpful for ego strengthening. Treatment models are crisis intervention treatment model to facilitate the problem solving during the crisis state, which includes clarification of the problem, expansion and management of the feelings, and used to both interpersonal and institutional resources. Short-term model treatment. Short-term treatment model includes clear identification of problem, partialization of that problem, restricted and limited goals, focus upon the problem of interpersonal rather than the intrapsychic or instinctive problems, clear definition of possible choices of action on the client's part, and exercise of the client's decision-making capacity with the limits of his reality. So after diagnosis, the next stage is treatment. For example, if you go to any physicians, first physician is to diagnose and thereafter they is to provide treatment accordingly. Accordingly, they is to provide treatment based on your disease. So here in social science, it is quite difficult to give adequate treatment because we are not using treatment in tablet form or any capsule form or any liquid form. So our treatment is based on the existing services. So here we used to uh, help our client with supportive techniques, that is indirect treatment, and here we try to change the environmental manipulation, then we used to reflect the things what is happening, and sometimes we took help from the community, that is reflective technique, and you are using counseling technique, which we can consider as a direct technique of treatment. And in that counseling technique, we used to motivate the client, then we used to use our psychological knowledge to deal with, and we used to strengthen the client's ego, by which client will be able to take his or her own decision towards his problem solving. So in that way we are we are helping the clients, and this helping process is known as our treatment. And we were using various models. I offered here only two models. Thank you. Have a nice day to you all.